we're going to discuss 5 medications and supplements used in the treatment of PCOS. I want to reiterate, PCOS is a lifelong condition, and we need to create an individualized plan for you that works for you in order to deal with these symptoms as they ebb and flow. They come and go and they change. PCOS doesn't just impact your fertility, but it impacts your overall health care. I included today in the video notes my download of labs, supplements, and more lifestyle tips to help you navigate your diagnosis, or if you think you have PCOS and haven't been diagnosed yet, grab that download. All right, let's begin. Number 1, most common thing I see in the videos that are being prescribed to you is birth control, and many do not want this. Let's take a look at why birth control is prescribed. So we know that PCOS is a hormonal imbalance, and oral birth control pills increase your estrogen levels and lower those testosterone or DHEA levels, also known as androgens that we've talked about, or your male hormone levels. And that in turn balances your female hormone levels. This keeps them balanced. It keeps you feeling good. It suppresses acne, weight issues perhaps, or perhaps you're gaining weight because birth control is not working well with you, and brings your period back as well. As these levels decline, your symptoms improve. We see things like improvement in your acne, cycle regulation, and more. So the negatives of birth control, perhaps you just don't want that, or you're told that's the only thing out there to help you with this, and that's not true. It's simply not true. There's an overall approach to PCOS, and birth control is not the be-all, end-all to fix this. Many were placed on birth control really early on, and often for symptoms of PCOS that just were, here you go, here's your birth control. So now that maybe it's time that you're thinking of coming off for many reasons, now these symptoms are flaring. Perhaps you went off and 3 months later, here's acne and your cycles and many other symptoms are now appearing. We see this happen a lot after stopping birth control. I try to get my patients regulated with supplements and other lifestyle techniques before coming off birth control. It makes the whole transition really a lot more tolerable. Medication number 2, Metformin. Where have we heard this medication before? In the treatment of type 2 diabetes. So this medication makes the body more sensitive to insulin. In turn, it can help lower elevated blood glucose levels and androgen levels, our male hormones. When the body's able to better respond to insulin, it actually in turn decreases the amount of sugar that the liver makes. Also, it decreases the amount of sugar that the intestine absorbs from food after eating. The side effects of this medication are often the reason why we stop taking it: the diarrhea, the gas, the bloating, and not to mention, these are huge pills that you have to take 2 to 4 once or twice a day. They're just not pleasant, and many just want to know what other options are out there. Metformin is one of them from the prescription standpoint. Let's dive into some supplements. Number 3, Myoinositol, hands down one of my favorite, and in fact, it has been studied next to metformin to be just as effective with way less side effects. This actually is found in many foods, including cantaloupes, oats, bran, citrus fruits, and more. The mechanism needed in women with PCOS to convert inositol to its bioavailable form is not working as it should. Myoinositol is produced naturally by the body, but women with PCOS tend to have lower levels of it. The exact mechanism by which inositol improves ovulation and pregnancy outcomes is not fully understood, but we know it's likely linked to glucose and insulin levels. Next, Knack, or N-acetylcysteine. This supplement increases the cellular levels of antioxidants, and it's thought to improve insulin-resistant receptor activity and improve our insulin secretion in response to glucose. When there is a decreased level of circulating insulin, it can lead to significant reduction in testosterone levels and our free androgen levels, male hormones floating around. I'm going to throw a bonus in here. A lot of my patients are candidates of berberine, which is really great too for PCOS. I once again encourage you to work with a provider who understands supplements and medications all in one, because you may not need all of these. You may need some of these. So working with a provider who understands supplements and is willing to work with you and add these into your routine is really important. Vitamin D. Let's not forget one of the all-time best supplements around, vitamin D. This is not only used for fertility and overall health, but also for PCOS. It helps regulate more than 200 genes in our body. The benefits are insulin sensitivity improvement. It assists with follicles and our overall hormones to help improve our health overall, as well as, let's not forget, progesterone production, which is really important as a female. One study actually demonstrated that supplementing vitamin D at high dose for a period of at least 12 weeks is thought to lead to improved glucose levels, insulin sensitivity, our cholesterol levels, and overall hormone function as a female. I encourage you to have a conversation with a healthcare provider that understands supplements and can help better navigate this process for you. If you like today's video, make sure to hit like, hit subscribe for new videos every week, and share this video with a woman in your life who you feel can benefit from being empowered about their healthcare, their hormones, and fertility.